today's topic is central nervous system infection. ঠিক আছে, তো I have 3 case discussion. So we'll start off with a case discussion and then we'll slowly come to what are the infections in the CNS and how do we diagnose them. ঠিক আছে, so starting with the first case. So this is one 18-year-old female. See, case discussion না প্রত্যেক কটা সাবজেক্টেই থাকবে, ক্লিনিক্যাল ওরিয়েন্টেড যেগুলো সাবজেক্ট রয়েছে every subject will have a case discussion, because the more you do case discussions, the better physician you will be one day. The more you read case discussions, the better differential diagnosis you will have in your mind. যে ডাক্তার যতগুলো ডিফারেন্সিয়াল ডায়াগনোসিস বার করতে পারবে তার স্কিল তত বেশি, তার ডায়াগনোজিং পাওয়ার তত বেশি, এবং the analytical skill depends on the DD of the case. So we'll start off with the case. 18-year-old female is admitted in a hospital with 12 days of fever, intermittent fever cholche 12 days and 5 days of vomiting. ঠিক আছে, and the associated condition is the patient is having headache and neck pain. So whenever you are having a patient which is having a fever, neck pain and a headache, the first thing that should click in your mind is what is the system that is involved. Is it the respiratory? Is it the biliary? Is it the urinary tract, or it is the CNS? CNS? Okay. So এই স্লাইডটা থেকে এতক্ষণে পর্যন্ত যেগুলো বোঝা গেছে যে ডিসওরিয়েন্টেশন আছে, ভমিটিং আছে, ফিভার আছে, হেডেক আছে, নেক পেন আছে, প্রবাবলি দিস ইজ গোয়িং টু বি সাম মেনিনজাইটিস. ঠিক আছে, CNS এ তিনটে ক্যাটাগরি অফ থিং ইউ হ্যাভ টু নো. ওয়ান ইজ আ মেনিনজাইটিস, ওয়ান ইজ আ এনকেফালাইটিস অ্যান্ড ওয়ান ইজ এনকেফালোপ্যাথি. তিনটে জিনিস. ওকে, সো দিস ইজ লুকিং লাইক এ মেনিনজাইটিস. Okay, why we will slowly understand. See, the temperature is 99.8, pulse is normal, respiratory rate is normal, blood pressure is normal, saturation is normal. Okay, nothing alarming, but the patient is conscious oriented, but she is a little irritable. Okay, now we did a report e ki dekha gelo WBC count is 12,200, which is a little elevated. Then we have a renal function which is more or less normal. Creatinine is normal, this is 0.56. And we did a urine also which is no growth, and LFT was normal. And we thought of it is a meningitis, and we did a CSF. Okay, CSF study. CSF study te ki dekha gelo glucose is 33. That means glucose is low. Okay, protein is elevated, WBC is again elevated, WBC elevated, protein elevated, glucose is low. And what we did is we did a CSF GeneXpert. GeneXpert is nothing but a CBNAT. CBNAT মানে হচ্ছে একটা ফর্ম অফ আ PCR which is a cartridge based. একটা মেশিন আছে, একটা কার্ট্রিজ আছে, CSF নিলাম, ডাইলুয়েন্ট দিলাম, কার্ট্রিজের মধ্যে ভরে দিলাম, মেশিনে দিয়ে দিলাম, মেশিন উইল গিভ দ্য রেজাল্ট. আই ডোন্ট হ্যাভ টু ডু এনিথিং. ওর মধ্যেই এক্সট্রাকশন হবে, ওর মধ্যেই অ্যাম্পলিফিকেশন হবে. ঠিক আছে, সি দ্য CSF GeneXpert has revealed the disease. It is a Mycobacterium tuberculosis. So Mycobacterium tuberculosis is one of the major cause of meningitis. ঠিক আছে, so this is a case of meningitis caused by Mycobacterium tuberculosis. Now the thing is, have you had waited for a ZN stain? কেউ বলতে পারে না আমি তো ZN স্টেন পাঠিয়েছি, ZN স্টেন তো নেগেটিভ আছে, নো অ্যাসিড ফাস্ট ব্যাসিলাইসিন ইন দ্য ZN স্টেন, সো আই হ্যাভ নট স্টার্টেড টিউবারকুলোসিস ট্রিটমেন্ট. ZN stain, any kind of stain, it is not 100% sensitive. It may be specific, but stains are not 100% sensitive. See, if you have a bacterial load of at least 10,000 per ml, then you will find a positive slide under the microscope. যদি ব্যাকটেরিয়াল লোড হয় সাপোজ 20টা ব্যাকটেরিয়া আছে 1 ml এ, you will never find that thing in the microscope. You will get a negative report. So stains are not confirmatory for the sensitivity. If you have a positive stain, then it is fine. It is specific, it is positive. But if the stain is negative, especially if the sample is a extrapulmonary sample. Sputum hole, the NTP has said you have to give 2 samples, spot sample, morning after sample. If it is an extrapulmonary sample, that is anywhere other than lungs, then EPTB is mostly paucibacillary. That means the bacillary load is very low. So whenever the bacillary load is low, you should not expect that the ZN stain will come positive all the time. It may come negative, but that doesn't mean the patient is free of TB. You have to rely on these things, either PCR or culture. Culture will take around 4 to 6 weeks. So 4 সপ্তাহ পেশেন্টটাকে তুমি ঘুরে আসতে বললে patient will land up in something else. You have to do the molecular testing. There is no point of doing antibody testing in these kind of cases because antibodies are not reliable in tuberculosis. Okay, so this is a case of GeneXpert, positive TB. First, the patient was started off with ceftriaxone, acyclovir, and the supportive treatment. But when the diagnosis was confirmed, the anti-tuberculosis medication was started, and the patient got better. Okay? So this is how the cases will be coming to your OPD. Now, this is the case 2. Case 2 te ki bolche? 22-year-old female, which she had a history of traveling to some place, and then she had a dog bite. So dog bite er pore kothay hoyeche na wriste. 7 days before she had a dog bite, and then she was treated somewhere. The documentation is not available. And then the patient was taken to the emergency department with a complaint of disorientation, altered sensorium, and irrelevant talks. So whenever you are having a disorientation, altered sensorium, irrelevant talk, the first thing that should come into your mind, if the history of dog bite was not there, jodi nei dog bite history nei, patient emni emergency te esche disoriented hoye, GCS is very poor, patient is disoriented, okay, patient is drowsy, the first thing you should suspect is hypoglycemia and dyselectrolytemia. If the patient is apparently normal, a healthy individual, comorbidity nei, then you should first suspect something like dyselectrolytemia and hypoglycemia. Glucose kome jete pare, sodium potassium kome jete pare. But now this case has a definitive history of a dog bite. Dog bite history te you cannot miss rabies. First thing, think of rabies. Then you see the patient had a difficulty in swallowing water and breathing. Ki bole jinistake? When you have a difficulty in swallowing water and breathing in case of rabies, what is that symptom called? Hydrophobia and aerophobia. Correct. So the Glasgow Coma Scale is E3V2M5. E3 is okay. V2 is a problem. M5 is again slight a bit problem. এগুলো বোঝো? GCS বলে কি জিনিস? এই যে E3V2M5 এটা কি লেখা আছে বলো তো দেখি। I'm telling something you are not understanding, you are keeping quiet. E3V2M5, what is it? Glasgow Coma Scale is a scale which is used to assess the patient's orientation and consciousness. At a patient yellow drowsy, you tell it is a drowsy, I tell the patient is not drowsy. So we have to have a consensus ki ekta kichu marker kinba ekta kichu quantitation ki drowsiness ta kotota ba ki type of drowsiness ba something which is related to the patient's consciousness. E mane hocche eye opening. Okay, so the whole Glasgow Coma Scale will be total 15. The egulo add kore na 15 hobe, egulo add kore 15 hobe, ঠিক আছে? So E means হচ্ছে eye opening, V হচ্ছে তার vocal response, M হচ্ছে তার motor response. Okay, so we assess কি পেশেন্টটা কতটা চোখ খুলতে পারছে, ওকে ডাকলে চোখ খুলছে নাকি ওকে ঠেলা দিলে চোখ খুলছে। ভি হচ্ছে ভোকাল রেসপন্স, ভার্বাল রেসপন্স, পেশেন্টটাকে ডাকলে সাড়া দিচ্ছে কিনা, পেশেন্টটাকে ঠেলা দিলে সাড়া দিচ্ছে কিনা, কিংবা পেশেন্টটাকে যদি আমি খুব পেইনফুল স্টিমুলাস দিই তাহলে ভোকাল রেসপন্স করছে কিনা। আর মোটর রেসপন্স হচ্ছে সিমিলারলি আমি যদি পেশেন্টটাকে বলি মুভ ইউর হ্যান্ড, ইফ হি অর শি ইজ মুভিং হিজ অর হার হ্যান্ড, অর ইফ আই টেল দ্য পেশেন্ট কি হাতটা ধরে আমি সরাচ্ছি পেশেন্টটা রেসপন্স করছে কিনা, কিংবা কোনো রকম পেইনফুল স্টিমুলাস দিচ্ছি তখন পেশেন্টটা হাত কিংবা পা সরাচ্ছে কিনা। সো অল দিস থিংস আর জাজড on a scale. সেই স্কেলটা হচ্ছে Glasgow Coma Scale, which every day we are using for the patients who are coming to the emergency. If the patient is normal, alert, conscious, we'll write GCS 15/15. If the patient is having a slight disorientation or irrelevant talk, we will divide this into these kind of category. এবার তিনটেতে add করলে এখানে কত হচ্ছে দেখো 7 আর 3 10. So the GCS is down 10/15. এরকমও আছে when there is some level of GCS down, ওই GCS এর পরে you cannot keep the patient lying on the bed. You have to do a ventilation. You have to put the patient on ventilator, otherwise the patient will not survive. So GCS is very important in the emergency. Okay, so the GCS was down 10/15. Then the verbal response was incomprehensible. Patient কি বলছে কেউ বুঝতে পারছে না. The family had provided a account that patient dog bite এর পরে post exposure prophylaxis নিয়েছে. Now tell me the reason কি আমি একটা dog bite হলো, I have taken a PEP, post exposure আমি নিয়ে নিয়েছি. Rabies immunoglobulin has been given. I have been started with this rabies active vaccination. What may go wrong? Then why did I develop a rabies? ও তো বলছে ইনজেকশন নিয়েছে. Then what is the problem? Yes, last bench. What may go wrong if the patient has already taken a post-exposure prophylaxis but again she presented in the ER with symptoms of rabies? Why? Think and tell. It is not written there. The problem is you won't think. যে খাবারটা খাচ্ছ সেটা তো এক্সপায়ার্ড হতে পারে না? So before eating you check the expiry date, no? But she has not a document of this vaccination. So we don't know what kind of vaccine she has taken. Maybe the vaccine is expired. Maybe the vaccine is not expired but the cold chain was not maintained. Vaccine transportation তো cold chain maintain করতে হয়. তো cold chain না maintain করলে ভ্যাকসিনটা কি হবে? The efficacy will be 0. So she might have taken a vaccine but the vaccine didn't work. তাই না? হতে পারে. So there are n number of possibilities. Then the CT scan was done, the CSF was done, and then the CSF revealed protein is 506. Just imagine. CSF glucose was normal. Whenever CSF glucose is normal, think of viral etiology. Bacterial কিন্তু খুব একটা CSF মানে গ্লুকোজটা নরমাল থাকবে না. Glucose will be low because bacteria loves glucose. They will eat the glucose up and glucose will be low. But এখানে কিন্তু glucose was normal and then blood examination count বেশি ছিল. Obviously the patient was having a hydrophobia and a photophobia. So this MRI was done. MRI te this abnormal T2 hyperintensity was seen. Lentiform Fox sign was seen. Post contrast enhancement chilo na. It was a classical for a rabies encephalitis. So this was the MRI. Rabies encephalitis was diagnosed. Slowly, see, whenever you diagnose a rabies, that is the death sentence. You cannot make the patient well again. If the patient is diagnosed rabies, he or she will die. No matter whatever you do, he or she will die because there is no treatment for rabies. Okay, we had a patient in ICU. She was staying there for 1 month. She was having a rabies for a long time. She was surviving for 1 month on ventilator. Every day she was having seizure. Every day she was having seizure. Ultimately, the patient had a cardiac arrest. Similarly, this patient also developed AKI, automatically acute kidney injury. Kidneys will shut down, the creatinine will go up, potassium will go up, the patient will land up into dialysis. But ultimately, the rabies will progress, the patient will have seizure. Ultimately, she or he will be dying out of cardiac arrest. Okay, so that's what happened, and the patient died. This is case 3. Very, very, very interesting case 3. You will find this kind of patient if you are practicing somewhere, in the outskirts of the city. You will definitely find cases like this. See, the child came with a complaint of fever, headache, vomiting, altered sensorium. Very important. Okay, I will tell you one thing. Whenever you are having a patient with a fever and a neck pain and a headache, think of meningitis. Fever, neck pain, headache, meningitis. Vomiting may be there, may not be there. Whenever you have a patient of fever, headache, disorientation, altered sensorium, these kind of things, which is mainly focusing on the the functionality of the brain. Think of encephalitis. Encephalitis means there is some problem in the brain parenchyma. Meningitis means there is inflammation of the meninges. Encephalitis is the inflammation of the brain parenchyma. Meningitis is the inflammation of the meninges. Okay. So, this patient had altered sensorium, fever. So, what do you will expect out of this? Meningitis or encephalitis. Then the patient also had generalized tonic-clonic seizure. Whenever a patient is having seizure, think of the brain parenchyma, don't think of the meninges. The patient had a seizure. So, he was a kid, 5 days of fever, 4 days of headache, 3 days of vomiting, 1 day of altered sensorium, classical encephalitis. Okay. Now, you see the history is very, very important. History যদি না নিয়েছো তাহলে তুমি patient diagnosing করতে পারবে না. History was the patient had a residence which is near paddy field. ঠিক আছে, গ্রামে থাকে, ক্ষেতের পাশে বাড়ি, ক্ষেতের পাশে প্রচুর মশা এবং they also had pigs. Whenever you see things like this, mosha, pig and everything, no, think of life cycles. Always think of life cycles. So, which life cycle would fit? Ki mosquito bhi ache, pig o ache. Mosquito ache, pig ache, human ache. Recent travel history nahi, so it is not a foreign imported thing. Tuberculosis, no history. Trauma, no history. Because if you find low GCS and all the altered sensorium, you may think that oh acha tale mathay bodha keu mereche tai jonno hoyse. No history of trauma, no history of TB. So TB meningitis ruled out, trauma ruled out. Pig ache, mosquito ache, life cycle. Think. Bacterial, viral, parasitic. Kon parasite mathay chole gelo pig Okay, so we did a clinical examination. Concentrate. We did a clinical examination. GCS was down. You see, 11/15 was the GCS. There was neck rigidity. Again, I am confused. Neck rigidity ache. It can be meningitis also. There was hypertonia. There was a brisk, deep tendon reflex. Bilateral plantar was extensor, and then lab investigation was done. Lab investigation ki pawa gelo? Hemoglobin is fine, 12.5. Total WBC count marginally high, 11,800. Platelet count is okay, 2.4. Biochemistry, see, blood sugar is fine, urea fine, creat fine, sodium is a little down but fine, 132. Then you have CSF. That will clear everything. CSF picture ki bolche? Clear ache. Then you have 80 cells. Is it elevated? 80? Is it elevated? Oh yes. CSF cell count koto? What is the normal cell count? Do you have 80 cells in your CSF? No. Have you had 80 cells in your CSF? You would have this kind of symptoms. 0 to 5. 0 to 5. Okay. If you have 12 pus cells in urine, it is normal. Is it normal? What is the normal range? So you have to know the normal range. Patient report dekhate chhe ami jani na konta normal konta abnormal, bole dillam normal. The patient will die outside. Okay. CSF 80 is high. Okay. Then you have cell type, you see, lymphocytic predominance. So most of the cells in the CSF are lymphocytes. Then you have the protein, which is 85. Again, protein is a little bit, glucose is normal. Okay. Then you have a MRI. MRI will again clear the picture. You see, bilateral, symmetrical, hyperintense lesions found in thalamus, found in midbrain and found in the basal ganglia. So what does it suggest? The parenchyma is involved. It is not the meningitis. So forget neck rigidity. You see the brain parenchyma is involved. Now you start your differentials. Ki hote pare? Viral encephalitis hote pare? Japanese encephalitis hote pare? Viral encephalitis JE is the most important thing, and then you have HSV, herpes simplex, very, very common, herpes simplex. Okay. Next you have cerebral malaria, then you have tuberculosis, tuberculous meningitis, then you have scrub typhus and dengue and autoimmune. Okay. Ektar par ekta sab test korte thako. So I would suggest go ahead for a CSF PCR. Multiplex PCR from the CSF will give you result in 2 hours. The last week I had a patient Epstein-Barr virus positive in CSF. Okay. So it will give you magical results. So you see, we did a CSF and then the CSF was positive for, the CSF ELISA was positive for JE, Japanese encephalitis. Okay. So it was a Japanese encephalitis and it matched the whole thing. So what you should think is, যখন MRI দেখছো, it is involving the parenchyma, think of the DD of the encephalitis. কি হতে পারে? Okay, the CSF picture will differentiate কি ওটা ব্যাকটেরিয়াল আছে, কি ভাইরাল আছে, কি প্যারাসাইটিক আছে, কি ফাঙ্গাল আছে. Okay, so we'll come to the main portions. Meningitis again, bacterial, acute, chronic bacterial. Chronic bacterial এর মধ্যে think of tuberculous, think of spirochetal disease, think of Lyme disease and everything. Then you have acute bacterial এর মধ্যে সমস্ত ব্যাকটেরিয়া গুলো রয়েছে, তার মধ্যে অ্যাডাল্ট, তার মধ্যে চাইল্ডের ক্লাসিফিকেশন রয়েছে. You have streptococcus, you have E. coli, you have Klebsiella, you have listeria. All these things are there in the acute bacterial meningitis. Then you have tetanus, you have viral meningitis, and then you have encephalitis, যেটা আমি বললাম এতক্ষণ ধরে. You can have a rabies, you can have a HSV, you can have a JE. Then you have parasitic. Parasitic is rare in our like portion of the world, but then you have neurocysticercosis is very common. It is not rare. Neurocysticercosis you will find patient in you will find patient, but this free living amoeba এই দিকটা একটু কম হয়, western side এ একটু বেশি. Toxoplasmosis, fungal infection, yes, you do have cryptococcal patients, they will be having meningitis. So what is the strain of Cryptococcus? CSF SC for Cryptococcus. What is the strain will you do? Indian ink. You see, Cryptococcus is a capsulated fungi. It is a true yeast. So it has a capsule. So if you have to detect a capsule, you have to do a negative stain, because capsule is impermeable to normal stains. So you have to stain the background, and then you will see transparent, Cryptococcus with a capsule. Okay, so meningitis এর মধ্যে acute হচ্ছে the progression will be within few hours, the chronic will be more than 4 weeks. So any kind of meningitis which is persistent over 4 weeks will be categorized as chronic meningitis. You know the divisions of the meninges, anatomy? মনে আছে? বল তো কি আছে? Dura mater. এই তো ভুল করলি। হ্যাঁ, DAP, dura, arachnoid, pia mater. Okay, so this is the outer part. For the people who have forgotten, this is the skull bone, then you have epidural space, then you have dura mater, then you have arachnoid, then you have pia mater, and then the brain parenchyma starts. Okay, so acute bacterial er moddhe ki ache dekho, according to the age we can divide. So overall Streptococcus pneumoniae is more common for pyogenic meningitis. Other agents, they may include Haemophilus, other groups of Streptococcus. You can have E. coli, you can have Klebsiella, you can have Listeria. All these things. Acute viral er moddhe already bole diyechi. Chronic meningitis er moddhe over than 4 weeks jodi thake, it is categorized as chronic. Manifestation of meningitis, already I have told, neck rigidity will be there, vomiting may be there, fever will be there, mostly these things, and headache to achi. Encephalitis, the most important findings are altered sensorium. The patient may have seizures. The patient may have focal deficits. Kono ekta hoyto tomar paralysis kinba something, kono focal deficit hote pare. The viruses, already I have told. Encephalopathy is a little different. It is not encephalitis, it is not meningitis. Encephalopathy is a diffuse disease of the brain that alters some of the functions of the brain. Okay, it is not encephalitis, but again it is a diffuse disease which is nearing to encephalitis but not encephalitis, which may alter some brain function. এগুলো ইনফেক্টিভও হয়, নন ইনফেক্টিভও হয়. কিছু কিছু ফোকাল লিজন, মানে some of the lesions which are not present all over meninges or all over the brain, একটা পোর্শনে আছে, ধরো ফ্রন্টাল লোবে আছে. Okay, so those things can be brain abscess. Okay, because brain is one organ which is encapsulated in a very good protection. We have the CSF hovering or like giving protection to the brain all round. So any kind of organism which goes inside the brain may have a potential of having an anaerobic organism. Hote pare anaerobic. Okay, retroperitoneal infections can be anaerobic. Tell one place which the infections are mostly not anaerobic. কোথায় হবে? Anaerobic infection হয় না, কোথায় বলো তো দেখি? Yes, lungs. Common anaerobic infections are there in the tooth. Gum infections, anaerobic. Retroperitoneal, anaerobic. CSF, maybe anaerobic. Okay. Blood, maybe anaerobic. Okay. So these are the things you should think of. See, focal lung abscess, focal brain abscess যখন বলছি, automatically abscess বলতেই একজনের কথা মনে পড়ে, Staph aureus, তাই তো? Abscess মানে Staph aureus, but it is not the case here. Staph aureus may give rise to an abscess, you see, 10%. তাও কখন? If the patient has been operated, যদি ধরো কোনো শান্টিং হয়েছে, কিংবা কোনো রকম ব্রেন বসেছে, কিংবা কোনো রকম বারহোল হয়েছে, ঠিক আছে? So when you are operating on the brain, then you may have a Staph aureus which is going from outside to inside. But যদি ওটা endogenous হয় from secondary, from any organ, তাহলে see, Streptococcus is mostly the causative organism, which is 40%. Then you have anaerobes such as Bacteroides and Fusobacterium, আর gram negative যেগুলো আছে, E. coli, Proteus and all these things may cause abscess also. Acute bacterial meningitis এর মধ্যে আমি যেটা বলছিলাম দুটো ভাগ করা যায়, একটা neonates, একটা elderly. Neonates, you see, Streptococcus agalacti, then you have gram negatives, E. coli, Klebsiella, then you have Listeria. Adults এর মধ্যে more than 60 years, mostly it is because of Listeria and Streptococcus agalacti. Symptoms I've already told. Yes, these are the two symptoms which you should learn. এটা meningitis এ একটা হচ্ছে Kernig sign, একটা হচ্ছে Brudzinski sign. Kernig sign কে বলছে whenever the patient is having a meningitis, if you flex the leg from the hip 90 degree, সেখানে কিন্তু তুমি এই knee থেকে lower portionটাকে কিন্তু উপরে দিতে পারবে না, because there is a contraction in the hamstrings. Next is whenever you are having a patient which is having a meningitis, তুমি পেশেন্টটাকে যদি বলো you lie flat on the bed and then you try to pick up the patient with the head. Neck তো rigidity রয়েছে, the patient will not be able to touch the chin to the chest, and the patient will just rise up if you try to lift the patient with the head, and there will be automatic flexion or involuntary flexion of the knee and the hip. ঠিক আছে? So these are the two signs you will see. Lab diagnosis already told, CSF নিতে হবে. Yes, whenever you are collecting CSF, remember you have to use a lumbar puncture needle. It is a long needle, it is a LP needle বলে. Patient must be lying, অনেক রকম ভাবে collection হয়, but the most common collection is the patient will be lying on the bed sideway, ঠিক আছে? Flexion হবে for the knees and the chest, and you will be inserting the needle after proper disinfection of the lumbar area. The bones are L3, L4 or L4, L5. এই এরিয়াতে you have to insert the needle, and you will find a bit of resistance. যখন ইন্টার্নশিপে করবে তখন দেখতে পাবে যে যখন নিডলটা ইনসার্ট করছো there will be resistance because of the meninges, but whenever the needle is entered or it is inside the hollow cavity, তখন একটা loss of resistance পাওয়া যায়. So then you should expect that the CSF will be flowing out. CSF will never be refrigerated. CSF নিয়েছো vial, sterile vial, okay? So you have to have 3 sterile containers. একটা কন্টেনারে 3টে ডিপার্টমেন্ট তো পাঠানো যাবে না, 3টে কন্টেনার পাঠাতে হবে। কি কি? একটা যাবে প্যাথোলজিতে, রুটিন for cell count and cell type analysis, একটা যাবে বায়োকেমিস্ট্রিতে for protein, sugar and all these things. Next one will go for bacteriological or microbiological examination, PCR এ যেতে পারে, microbiology যেতে পারে। তো CSF টাকে you never refrigerate. Why? Because there are some organisms which are very sensitive to cold. Haemophilus আছে, Streptococcus আছে, so they will die. So you should keep the CSF in an incubator. The incubator পাওয়া যাচ্ছে না, keep it in the room temperature. Remember it. Similarly, if you collect blood sample for blood culture, do not keep the blood culture sample in the fridge. Again, the same. So you keep it in an incubator. Incubator nahi, keep it in the room temperature. So these are the two things you should remember. And we do CSF inoculation in blood agar, chocolate agar, and nowadays we are also doing, in the bactec machine. Bactec e amra CSF টাকে দিয়ে দিই. This is the parameter analysis. এখানে আমরা দেখব CSF pressure, leukocyte count, predominant cell type, glucose and protein. See, in the bacterial part, that is pyogenic meningitis, see, all the infections will be having a high cell. So এটাকে out of question. So cell is high, you are having an infection. That's not a problem. The problem is with the differential count. You see, ব্যাকটেরিয়াল পায়োজেনিক যদি থাকে, the predominant cell will be neutrophils. যদি সেটা tuberculous কিংবা viral থাকে, the predominant will be lymphocytes. If you have a glucose which is less than 40, think of bacterial pyogen. If you have a glucose of 20 to 40, slightly lower, you may think of tuberculous. If you have normal glucose, think of viral. ঠিক আছে? প্রোটিনের মধ্যে দেখো 15 to 45 is the range. So anything above than 45 is raised. So protein will be definitely raised in all these three, but the highest you will be seeing in the tuberculous. ঠিক আছে? tuberculous এ প্রোটিনটা অনেকটা বেশি raised হয়। Microscopy you will find either GPC, that is gram positive coccus in cluster, gram positive coccus in diplococcus, that is in pairs. Then you may see gram negative bacilli. You may see pleomorphic gram negative coccobacilli, that will be hemophilus. Pleomorphic GNCB is hemophilus. Gram negative diplococci jodi thake, then it will be Neisseria meningitis. Okay, and GPC in pairs with the flame or lanceolate appearance, Streptococcus pneumoniae. এগুলো তো নরমাল, এগুলো তো পড়েইছো, just the findings you will see. So you will be doing a culture in blood, chocolate agar and McConkey agar. আরেকটা এনরিচিং মিডিয়া দিতে হবে, ব্রেন হার্ট ইনফিউশন ব্রথ। এটা ব্রেন হার্ট ইনফিউশন ব্রথ না দিয়ে যাদের কাছে অটোমেটেড আছে তারা অটোমেটেড মেশিনে দিয়ে দেয়। Individual organism, Streptococcus will be giving you an alpha lytic colony, carom coin appearance. Neisseria will give you something like this, which is a gram negative diplococci in the smear, non-hemolytic colony. And this you have Haemophilus influenzae, which is very, very fond of factor 5 and factor 10. In Haemophilus, you will find very peculiar things like satellitism. Okay, satellitism, you see blood agar and chocolate agar er moddhe ekta difference ache. Ki difference bolo to? What is the difference between blood and chocolate agar? Don't tell me color difference. Last bench. Difference between blood agar and chocolate agar. Yes. হয়ে গেছে তো পরীক্ষা। এটা তো সেই একদম শুরুকার জিনিস, নর্মাল যখন কালচার মিডিয়া পড়ানো হতো নাকি। ডিফারেন্স বিটুইন ব্লাড আগার এন্ড চকলেট আগার। নেক্সট, কি ডিফারেন্স বলো? হোয়াট ইজ দ্য পয়েন্ট ইন ডুইং এ চকলেট আগার? হ্যাঁ, কি বলছো জোরে বলো। ব্লাড আগারটা কালচার মিডিয়া, চকলেট আগারটা না। হ্যাঁ, তো ডিফারেন্সটা কি? কোনো ডিফারেন্স নেই। সো ইটস সেম, তাই তো। দেন টেম্পারেচার ডিফারেন্স, ব্লাড আগারটা ঠান্ডা, কি চকলেট আগারটা গরম না কি? তো হলো তো, কি আছে? বসো, ব্লাড আগারে হ্যাঁ হ্যাঁ, তো কি হয়েছে? বেশি সিলেক্টিভ প্লিজ, ব্লাড আগার সিলেক্টিভ মিডিয়া। দেন এই শুনেছো কি বলেছে বলো তো? সিলেক্টিভ মিডিয়া, তাই শুনেছো, ভুলটা শুনলে। টেম্পারেচার ডিফারেন্সের জন্য কি হবে? টেম্পারেচার ডিফারেন্সের জন্য there will be a lysis of RBC. হ্যাঁ, তো RBC লাইসিসে কি হবে? আরবিসি লাইসিসে এখানে আছে কিন্তু স্লাইডটাতে উত্তরটা আছে। ইফ ইউ গো থ্রু দ্য স্লাইড ইউ উইল ফাইন্ড দ্য আনসার। হোয়াট ইজ দ্য থিং দ্যাট ইজ দেয়ার ইন দ্য চকলেট আগার which is not there in the blood agar? সিম্পল কোয়েশ্চেন। হ্যাঁ, বলতে পারছো না? আরবিসি কোথায় নেই? চকলেট আগারে নেই, ব্লাড আগারে আছে, তাই তো? হ্যাঁ, তো কি সেটা তো সুবিধা কি হয়েছে আরবিসি থেকে? হিমোলাইসিস হয়েছে, সবাই বলছে হিমোলাইজ তো অটোমেটিক্যালি হিমোলাইসিস হয়েছে, বাট হোয়াট ইজ দ্য অ্যাডভান্টেজ অফ দ্য লাইজড আরবিসি? দ্যাট ইজ দ্য কোয়েশ্চেন। কি লেখা আছে ওখানে? স্ট্যাফ অরিয়াস কেন স্ট্রিক করবো আমরা? ইউ সি, এই গল্প না করে এদিকে তাকাও। You see, Staph aureus we are streaking in the middle of the blood agar. Staph aureus কি করবে? Staph aureus কি করবে বলো? হিমোলাইসিস করবে। তাহলে হিমোলাইসিস করে এমন কিছু একটা বেরোবে যেটা কিনা হিমোফিলাস খেয়ে নেবে। কি জিনিস লেখা আছে ওখানে, পড়ো। ফ্যাক্টর 10 লেখা আছে, এক্স। এটা কি ভি নয়, এটা ফ্যাক্টর 5, এটা রোমান। কি অবস্থা, বলছে ভি, ফ্যাক্টর ভি, ওই লিখবে ফ্যাক্টর ভি, ভি এক্স ওয়াই জেড লিখে আসবে পরীক্ষায়। ফ্যাক্টর 10 অ্যান্ড ফ্যাক্টর 5, ব্লাড আকারে শুধু ফ্যাক্টর 10 পাবে, চকলেট আকারে ইউ উইল গেট ফ্যাক্টর 10 and 5. হিমোফিলাস কে you have to grow hemophilus, you have to give factor 5. So যখন স্ট্যাফ অরিয়াসটাকে তুমি স্ট্রিক করছো মধ্যেখানে, তো স্ট্যাফ অরিয়াসের চারিপাশে তো হিমোলিসিসটা হচ্ছে, তাই তো? তো হিমোলিসিসটা হলো মানে কি, এখানে ফ্যাক্টর 5টা থাকলো পাশে, যেখানে ফ্যাক্টর 5টা থাকলো সেখানে হিমোফিলাসের কলোনিটা বড় হয়ে যাবে। সি দ্য হিমোফিলাস কলোনিজ আর বিগার নিয়ার দ্য স্ট্রিক। এখানে ফ্যাক্টর 5 রয়েছে, এবার যেই দূরে চলে যাচ্ছে দেখো ডট হয়ে যাচ্ছে, ছোট ছোট হয়ে যাচ্ছে, বিকজ ফ্যাক্টর 5 নেই। দিস ইজ স্যাটেলাইটিজম, ডোন্ট ফরগেট। মুখস্থ করলে বুঝতে পারবে না, সবাই মুখস্থ করেছে বুঝতে পারবে না, কেউ বলতে পারলে না ফ্যাক্টর 5টা লাগবে চকলেট আকারে। ওকে, আন্ডারস্ট্যান্ড অ্যান্ড দেন ইউ উইল রিমেম্বার থিং। যদি মুখস্থ করো তাহলে হবে না। ওকে, স্ট্রেপ্টোকক্কাস অ্যাগালেক্টি, अगेन beta lytic colonies, E. coli Klebsiella non lytic colonies. Treatment depends on the empirical regimen of your hospital, but more or less we start the treatment with a third generation cephalosporin or a carbapenem. Okay, IV. For the neonates we'll give ampicillin plus gentamicin এবং dexamethasone অনেক সময় অ্যাড করা হয় to take down the symptoms. Then come to the viral encephalitis, which is very important. Herpes simplex virus, তার মধ্যে অনেকগুলো ভাইরাস আছে। You have HSV1, you have HSV2, then you have HHV6, you have varicella, you have Epstein-Barr, অনেক ভাইরাস রয়েছে। তার মধ্যে কমন হচ্ছে HSV1, very common. Okay, then you have arbovirus. আরবোভাইরাসের মধ্যে যেটা বললাম সবথেকে কমন হচ্ছে জাপানিজ এনকেফালাইটিস। Okay, then you have West Nile. Rabies is actually common. Do you know some countries do not have rabies at all? They are rabies free country. জানো এরকম কোন দেশ যেটা রেবিস ফ্রি? জানো না? সি, আমরা তো চ্যাপ্টার প্রথম ওটাই খুলতাম যে কোথায় অড জিনিসটা আছে ওটাকে পড়বো। রেবিস ফ্রি কান্ট্রি জানো ভাই? Japan is free of many things. Japan has not got a lot of problems with infectious diseases, you know. Rabies free country, yes. In fact, ইন্ডিয়ার মধ্যে একটা আইল্যান্ড রয়েছে রেবিস ফ্রি। Find out. এবার বলবি ইন্ডিয়ান আইল্যান্ড কি কি আছে সব বার করি ম্যাপ থেকে। You know, okay, take down this as a homework. You will line list at least 5 places which are rabies free and tell me in the next class. পরের সপ্তাহে মধ্যে আমারই ক্লাস আছে। Okay, so I'll listen from any one of you the rabies free country list. Okay, rare causes এর মধ্যে কিছু আছে enterovirus, mumps virus which doesn't cause, yes. Slow viral disease, chronic encephalitis করে, measles and rubella which is very rare, and we have prions. Prion is a very important thing. Prion আলাদা করে পড়ানো হবে। Prion is a very important disease. Okay, HSV বললাম because HSV is common. It is a common 20%. See the incidence rate is 10 to 20% acute sporadic viral encephalitis. Okay, HSV1 very common. Children are mostly affected. Children. Treatment হচ্ছে IV acyclovir. Thank God we have a treatment now. IV acyclovir is the treatment which is given for 10 days.